Awesome associate needed in Maryland, not too far from Dental Nachos and Dentist Job Connect headquarters in Philadelphia. I'm here with my awesome friends, Dr. Ashley, Dr. Rohem. You guys are inspirations as a dental couple, as a social media stars. Before we jump into your job, I've followed Ashley for a long time, and you create so much inspiration. Roham, do you go along with it happily, forcefully, or somewhere in between?
I think that what I realized very early on is if you just go along with it, there's a lot of fun to be had,
Yeah,
gyrating your hips and jumping up and
yeah.
down, smiling for the camera and all that kind of stuff. It has turned into something that's been a point of joy for us for sure,
It,
especially because we started it during the pandemic and it was such an awesome thing to do.
that's how I started to get to know Ashley. I think Ashley, I always say it's not illegal for dentists to have fun. Sometimes it makes us think that way. Just go home and memorize the Krebs cycle and look at your articulator. So I love that you do that. So I'm so happy to be helping you through Dentist Job Connect. Find your associate, bond together, dentist pun intended. So we're going to go through some questions, talk for a little bit. So first of all, where is this job? Where will this associate be working?
Okay, so we are in Baltimore, Maryland. We are in an amazing location because we are 20 to 30 minutes from the most beautiful earth that you could see, with rivers, places to hike, paths to ride bikes on or skate. It's truly remarkable to be that close to that beautiful of nature, a couple hours away from snowboarding or skiing if that's your thing. And then on the flip side, we're also 20 to 30 minutes away from the most beautiful parts of downtown Baltimore by
Nice.
the waterfront, where there's, modern hotels and restaurants. And just 5 minutes down the street from there, you'll find like historic Baltimore, also on the waterfront, but, the more iconic Baltimore, I would say. So it's a great place to be. It's a great place.
I want to remain friendly. I've been to Baltimore, and I will say that your food and sports teams almost as good as Philadelphia. But the Ravens are having a good year. But you've come to Dental Nacho C events in Philadelphia, so it's close to coming to Philadelphia and New York as well.
Yeah, I think
Yes,
that's one of the coolest things about Baltimore is that we are so connected to all the other cities on the East Coast between, being less than an hour from DC, an hour and a half
Yeah.
from Philly, a 2 hour train ride to New York City. Like it gives us a lot of opportunity to explore the East Coast in a really easy way, whether we're driving or taking the Amtrak train. And that's something we've really enjoyed over the last couple of years doing as well.
Love that
yeah.
East Coast offices. Now, this is one of the most important questions. I've given a lot of lectures on this. Why do you want or need an associate? I'm kind of known for saying, is your associate position a car that's a need, or a want, like a boat, right? Both can be there. But I found that sometimes associates, maybe you guys early in your career, you would go somewhere and they weren't busy enough, and I call that a boat position. Or you go somewhere they never had an associate before. So tell us about, why are you looking to add a dentist to your practice?
So I love that analogy of the want versus the need. I think we're in a really great place to really want somebody more than need somebody. We have a really great functioning practice. We've implemented so many different technologies thoughtfully through the years, intended to make the practicing life of a provider better, and at the same time make the treatments that we provide for our patients that much better. So it provides a really great experience for both the provider and the patient. And through those years, we have a good team that's been built to provide for our patients. And what we're at now, like you mentioned, rather than needing somebody, wanting somebody to kind of help us take Valley Dental Health to the next generation. We have so much potential in our office from the perspective of treatments that we offer for patients, as well as benefits that we give to our providers, that we really just are looking for that person that wants to establish themselves in a high-tech office that provides really good ethical treatment for the patients in a really fun, positive team atmosphere.
And that's why, I love dental teams. I have 2 offices. I own with my brothers. We have specialists. You're like, just before I go to my next question of what the associate's going to do, just tell us about your dental team for context, because there's more than just you 2 in the office.
Yeah. We have a staff of, I want to say 20 something, because we're constantly hiring new team players. I'm a big baseball player, big baseball fan, and I just feel like if there is a valuable team member, we will find a place for them. If they bring a good attitude, a good energy, a want to help kind of attitude for their team members, I feel like there's always room for those kinds of team members.
And that's exactly what we've built. I mean, our team, we have three amazing associate doctors. One is part-time, two are full-time. And one thing that we're so proud of is we really find what is your strength, what is your passion, and we just raise you up and elevate you in that. And so we want our doctors to have their own practice, their own patient base. We do marketing, we support them to grow whatever it is they want to do. We have a doctor that was like, I love laser dentistry. You know, we mentored her and supported her in finding her passion, and she went into laser dentistry. We have another doctor that is really into surgery, and so he's getting a lot of mentorship from Roham in going towards placing a lot of implants. We do fancy things like PRF with our extractions, and so it's just been really exciting to see what people's passion is and to see them elevate themselves.
I love it. Like a good treatment plan, you customize the associate experience to what they do, because now that will lead me to the next question. You know, what is this associate going to be doing most of the time? You know, people talk about restorative dentistry, crowns and fillings, the opportunity to do specialty care. If someone was listening saying, hey, I'm interested in this job, but tell me what type of procedures they're going to be doing most of the time.
Great question.
That is a great question. And I would throw that right back at you and say, we need to talk to the applicant to determine what they want, because the possibilities are really limitless. Yes, restorative dentistry, of course, the bread and butter. The expectation is always going to be that restorative dentistry is kind of the backbone, the foundation. But we consider restorative dentistry to also include things like alignment of teeth, because the restorations that we do are not going to last the way that we want them to if alignment is not there. So rather than kind of looking at it as restorative dentistry, we kind of look at it more like baseline dentistry.
Holistic,
there's the baseline dentistry that all of our associate doctors are going to be very well equipped to perform for our patients. And then after that, it's just a matter of what are you interested in?
I like to call it fundamental chips and additional toppings, right? You know,
absolutely, yeah, the additional toppings. Yeah, like Ashley was saying, we have the one doctor that I've trained on doing laser perio because she loves the laser so much, and she has actually gotten into periodontal treatment. Another doctor that wants to do implants and pre-implant surgeries.
All of our doctors are doing cosmetic cases.
One thing I'll share is I want to interject with, it's really good to be in a place where awesome dentistry is happening. Like we have a prosthodontist who's doing all in 4 cases. And are general dental associates doing that? No. Are they learning a lot by being in an office where that's being done? Yes. But I have a favor to ask you guys. So I talk to dentists and they talk weird. They say teeth fail. I say, don't say fail, say needs to be replaced. Don't say save. We can't maintain it. We're dramatic. But I'd like to ask you two, if you could help me. Could you do this for me? Stop calling it bread and butter dentistry. Because I'm just going to guess, when you go home at night, do you have a big loaf of bread on your table and a giant thing of butter for the family? Bread and butter is your cheap day at a wedding. So I wanted you to reframe it: kale and quinoa dentistry. We talk about bread and butter and nobody eats bread and butter. Okay. So I want to change it so I call that the fundamental chip. So we talked about the why, we've talked about the where, talked about the what. Now, if you've noticed, I graduated 2002 from dental school. My dental school is 3 times the cost that it was in 2002. I was actually just up there. That was Penn Dental. So it's important for people to talk about, how will the associate be compensated? Because we like straight answers, okay? So I say busy is a feeling, not a fact, right? So just walk me through, you know, if I'm like, hey, this sounds good, I can move to Maryland, you have a great why, I want to be there, I can do this, but I do have to pay my rent, I do have to pay my loans. Talk to me about compensation in general terms.
You know, we always like to meet our doctors where they are and have a conversation about what's important to them ultimately. But as far as the straight numbers go, 35% of collections, we have an individual billing department. We have 2 people that actually comprise our billing department. So our billing is on point. So the collections will be collected and they get 35%. Anything beyond that is all a conversation that we have, because there's plenty of other opportunities out there to enrich financially and otherwise that we have done for associates in the past, and we're happy to have those conversations.
And we have full benefits.
Awesome.
And we do really fun team building activities all the time. So that's really
I love that. And then I might ask, like, you know, would it be reasonable for an associate working full time to earn $200,000 a year in your office? Would they be able to collect 600 and earn 200? Is that something that would be reasonable?
I think it
way
would be
more
very
than
reasonable,
that.
So for context for my audience, because they don't talk about any of this in dental school, they teach us to rememorize the Krebs cycle. Helped me 0 times, not once in the operatory has memorizing the Krebs cycle. But would it helpful to know how insurance works? It would be helpful to know what to ask for an interview. So I'm really teaching here just as much as showcasing your job, because the dentistry is wild out there with associate positions. So I try to, you know, Have
You're
you
right.
been
And
in
that's
those
something that's
situations?
important to us. We have, we have an inter-office communication way that we communicate that's HIPAA protected. And our billing department will reach out to the doctors as soon as a claim comes in and they're like, hey, this claim didn't get paid for such and such reason. Make sure you do this next time. So we are on top of that as well, that communication. And our doctors do learn a lot about how insurance works, which is very important. We have to give them what they need and what they want so that we can get paid.
Yeah. I call the associates the aunt and uncle of the practice. They really learn what it's like to have a child. And my brother and I did such a good job with our associates. I don't think they ever want to own their own practice. So no, I mean, they see behind the scenes, but I think that's such a great learning. Mark Costas is one of my friends and mentors. And he said as an early associate, he'd hang out with the office manager, ask them why this didn't get paid. And those are the things dentists have to pay more attention to. So when you can just learn that, it's not on someone else's dime, but we can learn that when you don't have any risk, really, right? You're learning it underneath an environment, underneath other owners. You can take that and use it when you buy a practice. You can take and have better patient conversations. So I love that they teach that. So my last question of the 5 is, did you want to add something, Roham? You can ask.
No, I was going to say we actually have a cheat sheet that we provide for our associates, so they know, for instance, for a crown, we need to have a pre-op periapic.
Yeah.
For scanning and root planing, we need to have pre-op probing depth in a full mouth series, so that they know what they need to provide in order to get compensated for the work.
Yeah, we actually have a whole onboarding system. So when a doctor comes on, we talk to them about all the things, how to treatment plan, how to, give insurance the right information, all the things, where to park, it's like everything is there for you.
It's not easy to be a dentist though, because when you go get your hair colored, no one asks you to show a picture from your last hairstylist and say, is this covered or not, right? We don't have easy jobs. I have to share. You just walk in, there's no haircut PPO. So I do share that is one of our tougher jobs. Now, the next thing I want to ask is, dentists are people too, right? A lot of people think of us like the teachers that we thought lived in the back of the classroom. I seriously think some of our patients think we live in the operatory and just wake up. But let's go outside the operatory. And you guys alluded to it about the wear, but you can reinforce it. I'm a 33-year-old dentist. I'm not married. I moved to Baltimore. This is great. But when everybody goes home and goes to their families, other people, what are some fun things I could do in the area? What are some things that I can fulfill myself with? So tell me about that.
So you mentioned the Ravens are having a great season, but I don't know if you're a baseball fan. The Orioles are an up-and-coming team. We're the reigning champs of the American League East. Camden Yards is the best baseball stadium for my money in all of baseball.
Also, we're proud to take care of some Ravens players.
Oh, that's awesome.
Yeah, absolutely. So yeah, the sports scene is obviously very, very vibrant. But there's one of the best things about Baltimore, in my opinion, that you don't really know about until you live here for a while, because most people know about like the Inner Harbor. There's so many great neighborhoods that are just quirky and have their own little personalities between the restaurants and the bars that are there. There's, upscale neighborhoods like Harbor East, all the way to Hamden, which is kind of where all the hipsters hang out. And, the restaurants are all kind of 4- and 5-star restaurants, but they just have a completely different vibe than the upscale area of Harbor East. So there's tons of little neighborhoods kind of scattered throughout Baltimore like that we are actually in love with. We would love to help anybody that moves to the area Baltimore find out more about these places. Baltimore's just got a lot of charm that we love, that I think, especially for young people that are willing to go out to the bars. We don't.
That's your next TikTok, Ashley. It goes, do one of those things where if I went back in time and I was this age, this is what I do. Come with me around Baltimore. And I'm not joking, that would be very valuable you'd love to have that content for fun, but you could share that with an associate dentist, because think about, I practice where I grew up, right? And I'm not sure if you guys grew up in Maryland.
We did, yeah.
You didn't just decide to move to Topeka, Kansas to get an associate job. But now the way the market is, it's becoming more required to be more geographically flexible. And I think we should have compassion for dentists that did stuff we didn't have to do, right? I went back to my hometown. So I think we should understand that it could be scary. It could be stressful to move to another part of the country. And I think the more you can do to create trust, just like we show before and afters to our patients, show them the fun things there. But you guys have done a great job. I want just a couple more minutes. So I talk about at the end, there's 3 M's to success for associateships: money, morale, and mentorship. We talked about the money. You've talked about your morale of your fun things, but talk to me about mentorship. What is the opportunity to, hey, I can't get this tooth out. I don't know how to do this aligner. My patient called me said I was too young. This is too expensive. Can people walk out of their operatory and get on-site mentorship from you two?
Absolutely.
100%. So I can speak to that on a couple of personal levels. Just this Saturday, I met with all 3 of my doctors and we did a training on blood draw and PRF production so that they can start getting comfortable with using PRF in their surgical and their periodontal cases. We do that kind of stuff all the time. If the doctor says, hey, you do this, I want to learn how you do it. We're like, all right, let's pick an afternoon. Let's pick a Saturday. We'll get together. At this point, the 3 associates that we have are so like-minded that they're like, okay, I'm going to ask the other 2 associates to come with us.
That's great.
Really
So we get a
great.
really kind of group mentorship kind of mentality. I teach at the dental school, so teaching is super duper important to me. I teach at the AGD clinic. I absolutely love mentoring those residents, and I bring the exact same energy and desire to teach to my associates. And on the topic of just kind of broader mentorship, we're very lucky to be in an area that has 2 of the best, most world-renowned hospital institutions anywhere, Johns Hopkins and University of Maryland, which gives us a lot of mentorship opportunities outside of dentistry. There's so many connections that we have in the medical community. So if we're kind of looking at a funky sinus case or something like that, we've got ENTs that we can kind of ask for mentorship as well.
I think I know. Oh, go ahead, Ashley. I want to see your
So
stuff.
typically we do Zooms in the evenings, and it really, depends on doctor availability, but for the most part, we all love it. And so we're all there in our PJs and maybe we have a glass of something delicious that we're drinking. But we do case reviews. We talk about patient management. We talk about treatment planning. We talk about what got us to yes this week, what got us to no this week. We talk about what's going well, what's not going well. We talk about, what team member needs support or what do we wish that we could have, we walk into the operatory, a different setup or something. So the mentorship is really comprehensive. It's, how to talk to your patient. It's how to be professional. It's how to treatment plan. It's how to do good dentistry. So I do a lot of Invisalign. That's my passion. I've been a platinum Invisalign provider for a really long time. And so that's something that I'm now mentoring my doctors on, how to do a good clin check. What are you looking for? How to be efficient in the operatory. So everything that we can do, anything that our patient or our team needs help with, we are there to help our doctors.
I love that. I love those ideas of Zooms with fun beverages, talking outside the energy of the office. I think there's a whole value to just talking without the energy of that circus. I always say owning a dental practice and running it is like running a circus where the animals don't try to eat you, just slowly annoy you to death. The giraffe is complaining about their insurance. And I always say too, like, this is my representative, like dentists have to keep their crying on the inside. And when you can walk out of the operatory and have a bigger, stronger dentist who just has been there before and say, people used to tell me I was too young. People used to tell me I was ripping them off. Go back and do that. It truly is magical. And I love that you're sharing this position. People can text MD to 215-798-9897. People can go to dentistjobconnect.com to apply. But you shared one thing with me before we went live. Just the vision for this position, you guys said, is one where you want to have someone who considers being part of your team for more than a year. Just as we wrap up, tell us what that means to you.
Yeah, again, going back to what you asked about whether we want or need something, we feel really lucky to be able to say we want this person because it gives us the opportunity to really explore and find the right person for the position. Because we are definitely looking for someone to come in here, take advantage of all of the infrastructure that we've set up, use all the technologies that are relevant to them, that give them joy and passion, and to grow within our practice using the marketing protocols that we've set up, using the new patient intake system that we've set up, and just thrive the way that they feel that they've always wanted to thrive. What we've heard so many times is that people feel comfortable in our office in a way they've never felt in another dental office. And what we would love is for a dentist to come in, feel that, and want to integrate themselves into that, to be able to provide that atmosphere for future employees and team members, but also to take advantage of that atmosphere for themselves.
And grow their own practice. It's such a beautiful thing. Like, I love growing with my patients, growing old with them, but we do have a growth mindset. And so that's so important.
I love that. And also creating patient relationships with them. That's not you. I love when my patients don't want to see me anymore. Thank you. That was thank you for this gift, right? So I think, I think when you can create camaraderie like that in a real team, it's amazing. Well, love what you guys are doing. You represent everything that's good about dentisting. Make that TikTok for us. And thanks so much for sharing with us today.
Thank you.
Thanks, Paul.
Thank you for everything that you do for dentistry, Paul. We really appreciate you.
Thanks, guys. I really appreciate it.
Take care.
Thank you. Bye.